गुंजन, अगर आपके पास कोई पेशेंट 35 के आसपास आता है, तो what all tests you advise them in first go?
Okay, so after taking a detailed history, we normally, on the second day of her periods, we do an ultrasound and we do the basic fertility tests, which is the FSH, LH, estradiol, progesterone, prolactin, and thyroid levels. So these are going to generally tell us about her basic fertility status, and the antral follicle counts we assess on the ultrasound. Similarly, if she's a married woman, we advise the husband also to have a test, a semen analysis test, by having a 2 or 3 days of abstinence period. Now, if we are looking at if all the parameters are all right, then we normally, if the patient is married for more than 6 months or has had previous treatments, we would like to do a tubal patency test, which is also called a hysterosalpingography test. So all these tests are basically going to tell us what is the fertility status of the couple, and do we need to give this couple some additional help. Simultaneously, we also start with some prenatal vitamins like folic acid, some vitamin D3, and also multivitamins which have, zinc and vitamin C and vitamin E combinations, so as to enhance fertility. So based on the results of our test, we add on other medication if need be. And apart, if she is beyond 35, we also have to know her general health status. So we also like to do her complete blood count, which tells us about her hemoglobin. We like to do the sugars. We also like to do their thalassemia status. And of course, if there is a family history of diabetes, her HbA1c as well. So these are some of the tests which are going to tell her about her basic fitness. And then we proceed forward with what we have planned for the couple.
Right. Dr. Gunjan, usually with low AMH, one very important, we can say that procedure is being done by the doctors is embryo pooling. So what is your take on this embryo pooling?
Yes, definitely embryo pooling is required, because sometimes we find that, again, as I would again like to say, it is the number of eggs which will define the possibility of us having one normal egg. Okay, so if
Right.
the number of eggs is less, which we get on stimulation, a person with a low AMH, if she and a low antral follicle count, will definitely give us less eggs on IVF stimulation. So in those cases, to increase the chances of her getting pregnant, we would like to have as many eggs as possible and make them into embryos. So as we know that in young girls, there is no parameter or no guide which can tell us that how fast the AMH is decreasing. So if
Right.
a young girl comes to us with a low AMH, our purpose is to retrieve or to procure as many eggs as we can before she depletes, her ovaries are totally depleted of egg. So in these cases, we advise the person, the lady, to undergo multiple cycles of IVF so that we can have as many eggs and we make embryos and keep them as a backup. And then once we are done with having many embryos, then we start doing the transfers, so that the possibility of pregnancy is much higher than if we have just maybe 1 or 2 embryos which we have for her.
Right. So, Dr. Gunjan, how many cycles of stimulation you suggest, or like maximum how many cycles of stimulation we can have if we are opting for this embryo pooling?
Well, again, it depends, Purnima, that how many eggs are we getting in one cycle. So normally we find that if the protocol if we have applied, sometimes we have just one egg a woman is producing. So if she has a very low AMH and she's having one egg, so maybe 3 or 4, 5 cycles of IVF of minimal stimulation we might be doing. But if there is a patient who has given us 5 eggs in one cycle, and in the second cycle we have another 5 eggs, so that's enough for her. So basically we have to individualize the case, so the purpose is to get as many eggs as possible, and the younger the patient, the number can be less, but the older the patient, definitely we would like to have more number of eggs, so
Right.
that is the thing which we have to
Uh, Dr. Gunjan?
yeah,
Yes.
sorry. Yeah,
So we can say that yes, as many as 3 cycles of
minimum.
stimulation the lady can do.
Yes.
अच्छा डॉक्टर गुंजन, एक और बात है, लोग कहते हैं जितना आईवीएफ करवाएंगे, जितना स्टिमुलेशन में जाएंगे, हमारे एग्स, हमारी ओवरीज खत्म होती चली जाएंगी। क्या सच में ऐसा है?
नहीं, ऐसा नहीं होता है। ऐसा है कि हर साइकिल में जो, अगर आप नॉर्मल फिजियोलॉजी भी देखें, तो नॉर्मली एक एग हर साइकिल में मैच्योर होता है, पर उसके साथ 15-20 एग्स जो हैं वो साथ में बढ़ने शुरू होते हैं, और धीरे
हम्म,
धीरे करके वो ऑटोमेटिकली अपने आप डिस्ट्रॉय होते रहते हैं, और उसमें से, उस पूल में से एक एग जो है हमारा मैच्योर हो जाता है। ठीक है। सो अब आईवीएफ के जरिए हम ये क्या कोशिश कर रहे हैं कि ये जो 15-20 इकट्ठे बढ़ने शुरू हुए, इन सबको हम डिस्ट्रक्शन से बचा के और इन सबको हम मैच्योर कर लें। So definitely there is a hidden pool which is always there. So it is not like that we are exhausting the or depleting the ovaries. It is just that we are trying to retrieve the ones which are, there is a possibility of destruction. So that is why this concept that the ovaries will be totally depleted is not there, not relevant.
Right. So we can say it's a kind of myth that doctor is doing something with your ovaries. Rather, doctor is extracting the egg so that
Mm.
it could be used in coming cycles.
Mm.
Dr. Gunjan, what could be the reason of drastic fall in AMH? Because we have seen many cases where people said कि अभी 2 महीने पहले तो करवाया था, AMH इतना था और 2 महीने में इतना ज़्यादा. What could be the reason for this fall?
देखिए, सबसे पहले तो हमें लैब वेरिएशन भी बतानी पड़ती है। समटाइम्स व्हेन इट इज डन, दैट इज आल्सो हैज टू बी सीन। नॉर्मली इफ वी डू इट ऑन द सेकंड थर्ड डे ऑफ द साइकिल, दैट इज द टाइम व्हेन whatever is the AMH will be the ideal one. If we do it in the latter half of the menstrual cycle, then definitely the AMH will be less. Secondly, we also have to see factors. Was the very reason why AMH is falling is not known. It could be things like environmental pollution, it could be radiation, it could be pesticides, it could be many other factors, which smoking is another important factor. Then there could be some chemical agents, then use of plastics, all these things. Gradually people are kind of discovering that they may be causes for low AMH, but exactly it is difficult to pinpoint that why AMH is decreasing. Women who've had surgeries, ovarian surgeries or pelvic infections, they also tend to have lower AMH. So this is exactly to say why AMH is decreasing is not possible, unless definitely infection is the cause or there is a cause like surgical intervention has been done. But definitely what is important is that if we find that the AMH is low, we should not sit over and think that there are means that we can increase it. Then we should act
Right.
on it. So that is more relevant than finding the cause for decrease in AMH. And definitely the lifestyle which these days people are following, that also has a reason why the fertility is declining. So these things have to be corrected, and then diet has to be corrected, and less of junk and processed food should be taken. So these things may have a cause in decreasing the AMH.
And Dr. Gunjan, how frequent you suggest a lady to go for these important tests? Like once in a month, twice,
No, that
after
is not.
2 months, or like this?
No. See, what is important is that if a woman is married and if she's less than 35, so up to 1 year, we can think of, they can try naturally, and maybe they've done the test once, and that's fine. But beyond 35, if she's married for 6 months and has not yet conceived, then of course she should be going in for all the investigations. But for a younger couple, definitely, till 1 year, we should not raise, kind of be alarmed about things, unless, of course, there is a family history of infertility, or she has had some surgeries, or there is some, chronic infection. Or sometimes the patients even get themselves checked because, they've heard from their friends that somebody is having difficulty in conceiving, and so that is a different scenario. But actually, we should not be investigating in a young couple when they are married for within 1 year. So let them try naturally for a year, and then we talk about investigations. Similarly, when she's older than 35, then less than 6 months, we should not. We should let them have a natural conception. Beyond 6 months, yes, of course, we should not delay further.
Right. So we can say, yeah, yes, your age is really important, because as we are aging, our ovaries are just aging with us. ऐसा नहीं है कि हमारी एज बढ़ रही है और ओवरीज की नहीं. रिप्रोडक्टिव सिस्टम आपके साथ ही बढ़ रहा है. सो प्लीज टेक अ नोट. इफ यू आर नॉट इंटरेस्टेड इन स्टार्टिंग योर फैमिली राइट अवे, then please do visit fertility center, not for conception, just for seeking the help, which we discussed, the freezing process. It is really helping, and many of common people are also opting for this. It is just to summarize your fertility journey. It's not that कि आप बाद में pregnant हो ही नहीं पाएंगे. Just talk to your doctor, visit your specialist, and just see how the specialist would be able to help you in this journey. So we can say that yes, conception is possible after 35, and again, freezing is a very good option for you. So thank you, Dr. Gunjan. Thank you so much for joining today, and definitely it will help many of our viewers to decide कि freezing पे जाना है कि नहीं जाना है. 35 के बाद conception को कितनी जल्दी सोचना है या नहीं सोचना है. So thank you again, doctor, for joining. Thank you.
Thank you so much. Thank you.